All right, welcome back once again. Today we'll be taking it a little bit further from what we did yesterday, and we'll be talking very much on the subject title acetylcholine. Acetylcholine. I think last week we did a little introduction about muscarinic receptors and how they are stimulated by acetylcholine, and the various ester synthetic acetylcholines. All right, so today we'll be talking about the pharmacological activity of acetylcholine. Now, acetylcholine owes its pharmacological activity to positively charged quaternary ammonium group, quaternary charged ammonium group, and negatively charged ester choline group. All right, negatively charged ester choline group. Now, what these two does is actually they are actually responsible for making acetylcholine hydrophilic. So hydrophilic in the sense that it is water loving, and acetylcholine is susceptible to hydrolysis. Now, since it is water loving, then it has to go through some process of hydrolysis, the lysing of it by water. And there are two major enzymes that actually does this. We have the acetylcholinesterases. The acetylcholinesterase and butyrcholinesterases. Now, these two enzymes are involved in the hydrolysis of acetylcholine in an aqueous medium. All right. Now, talking about the pharmacological activities of acetylcholine and other synthetic cholinesters, we'll be discussing the effects it plays on the cardiovascular system. Now, the cardiovascular system, as we know, is gotten from the activity of two major systems put together: the cardio, which has to do with the heart, and the vascular system, which has to do with the cardiovascular system. Like we said, the cardiovascular system is simply a network of the vascular system and the cardiac system. Now we're going to look at how acetylcholine would affect the activity of the cardiovascular system. Now I just gave an annotated diagram of the heart and a supposed ending of a vessel, of a vascular vessel. So though some of these image are not ideally real, so it's just for explanation purposes. All right, now this is the heart. Ordinarily, you know that the upper part is the atrium and the lower part is the ventricle, or we can say the ventrum, right? And on the upper part we have the right atrium and the left atrium. The lower end we have the right ventricle and the left ventricle. All right, now there are some things that I will be explaining on the effect of acetylcholine on the cardiac or on the heart. It's just a little things to note about the effects on the vascular tissues. Now this is the left pulmonary ventricle, the left pulmonary vein, and the right. These two are the right pulmonary vein. Right? Okay. And this is the right pulmonary artery and the left pulmonary artery. This is the aorta. This is the supravena cava, right? and this is the inferior vena cava. I'm just giving you a list of some of the major labeling of this diagram. Now this is the SA node, a very important subject matter in this discussion, and this is the AV node, sinoatrial node, and the atrioventricular node. All right, so these two nodes are very important. We'll be discussing about them very well. And now coming to the vessel, either pulmonary veins and artery, coronary arteries, and any other vascular bed. We see that the actions of acetylcholine actually bring about what we call relaxation of the vascular bed. It brings about relaxation of the vascular bed. Hence, these arrows, it means there's a widening, there's a relaxation, there's a dropping in the contractibility of these vascular beds. Now, how are these things mediated? They are mediated as a result of the stimulation of, you see some black dot I did here, some black diagrams. They are stimulated by baroreceptors and chemoreceptors. Baroreceptors and chemoreceptors that induce the vessel. Now, these baroreceptors and chemoreceptors are can gain their origin from what we call the vagus nerve. So they gain their origin via the vagus nerve to initiate pressure and chemical responses on the tissue. Now, how does this happen? It happens via the stimulation of what we call the endothelial relaxation factor. Endothelial relaxation factor. We're going to talk about this as we progress. All right. Now, all of this occurs through the release of acetylcholine that causes the vasodilatory effect via the release of nitric oxide. So it causes a complete relaxation of the vascular tone and decreases total peripheral resistance. So it is the resistance that actually brings about contraction. Then by inducing it, it brings about relaxation. Hence, when there's a reduced contractibility, it means there will be reduced BP. The blood pressure is going to drop. Now, the relaxation of the vascular smooth muscles, like I explained before, is due to the presence of M3 receptors found on the endothelial linings of the vascular smooth muscles. Now, when these receptors are stimulated, they produce what we call the endothelial relaxation factor. Now, this endothelial relaxation factor is the nitric oxide. Now, talking about the cardiac effects, what it actually does to the heart. Remember the diagram I showed you about the SA node and the AV node? They are innervated by parasympathetic cholinergic fibers. And also the intramuscus and the ventramuscus are also innervated by these parasympathetic cholinergic fibers. But there's something unique about these two. The intramuscus are more endowed with these fibers compared to the ventramuscus. Now, at the ventramuscus, they terminate at a special conducting tissue known as the Purkinje fibers. They actually drain there. Now, talking about the physiology of the heart and the SA node, we know that the SA node is the pacemaker. It produces cardiac output through continuous depolarization. Through continuous depolarization of the SA node. Now, at threshold potential, there's what we call the activation of the action potential. Action potential initiated to the SA node through to the AV node, and then to the whole cardiac muscles. Now, when there is a transfer of this potential, it brings about contraction. So that's how contraction is brought about, by the stimulation of the SA node to produce action potential, travels through to the AV node and then to the cardiac muscles. The image I drew would explain that better. So this is how contraction is maintained all throughout one's lifetime. It is a continuous process. It continues throughout your lifetime. Now, imagine acetylcholine is administered intravenously. We know that the effect will actually bring about a reduction or a lowering of heart rate. Now, how is it going to do this? It is actually going to alter the ordinary physiological process, or the natural physiological process we discussed about. That is the activation of the SA node to produce action potential, travels to the AV node and cause contraction. So it's gonna do what I call a reverse action of the previous. Now, it actually does this by reducing the rate of depolarization at the SA node. And in essence, if there's a depolarization in the SA node, it means that there's increased repolarization of the diastolic, because the diastolic pressure is produced by the SA node. With this prolonged diastolic repolarization and delayed depolarization at the SA node, there would be decreased contractibility or decreased cardiac contraction. This is how it brings about its contraction effect, by actually reducing SA depolarization to increase the diastolic repolarization, and it brings about cardiac contraction, cardiac relaxation. Now, acetylcholine reduces cardiac contractibility by the action of the presence of M2 receptors on the heart. These M2 receptors, they are G proteins coupled receptors. They are G proteins coupled receptors, which when stimulated, they result to the activation of potassium gated ion channels. Now, what this does is that it leads to what we call hyper repolarization. And when there is hyper repolarization, it means there will be decreased cardiac contraction. The effect of acetylcholine on the ventricle is not as visible as seen on the atrium and the SA node. We discussed about that. But acetylcholine may cause a little of ventral muscle contraction. It may cause a little of ventral muscle contraction. Now, this is made possible if and only if there's an underlying adrenergic response, which largely suppress the atomicity of the Purkinje fibers. So these are just the little explanation of how the effect of acetylcholine is brought about on the cardiac tissues and on the vascular tissues. Thank you very much. You have a nice day.